Last time we were out at Audiology Hearing Aid Associates, we learned that there are no quick fixes with hearing loss. And I'm here with Dr. Danny Genevico again. And we learned last time that Barry has a hearing loss. And at this point, we're learning about how to fit him for a hearing aid. Walk us through this process.
Okay, the first thing is, you'll remember from the last segment, is we evaluate the patient to find out if they even need a hearing aid. There are some people that don't. They think they do, but we test them and find that it's normal. Barry, unfortunately, is not a case in point. So once we have determined that he did not have a problem that was medically fixable, we decided to see if hearing aids would offer him some benefit. So the first thing that we do is, of course, we have to have a device fitted to the ear. Sometimes we simply use a little tube in the ear. Sometimes we use what's called an ear mold, depending on the severity of the hearing loss. And so the audiologist would, of course, make sure all the fitting is okay. And then the next thing we do is to try to deal with the acoustic fit. So it's not simply how it feels in the ear, it's how it sounds in the ear. To do the acoustic fit, we are actually measuring what the hearing aid does in the ear. So you don't want to amplify everything. If a person hears some frequencies well and some frequencies poorly, then you only want to amplify those frequencies. We use a technique called probe measuring, where we actually put a tiny little tube into the ear canal. It's very comfortable, and we adjust the hearing aid to match the frequency range that his ear is requiring in order to be able to understand words more distinctly. And of course we do that for each ear. So essentially this would be very much analogous to the prescription that your eye doctor would do with your glasses or your contact lenses. In addition to measuring the frequency range to try to get it appropriate and hopefully not amplify things he doesn't need to hear, then we also have other settings in the hearing aid. So for example, we can set the hearing aids so that really loud sounds will not be uncomfortable and soft sounds will still be audible to him. So that the hearing aids now are automatic, they are digital, and so once we've got them set to the point that they pretty much meet the specifications of the hearing loss for the individual with whom we're working, then they don't have to do a great deal with the hearing aids. Some of them you can adjust if you need to, but the goal is to set the hearing aids so that the patient can put them in and pretty much just wear them with the hearing aid doing its own adjusting depending on the environment that you're in. And so that's the primary purpose of doing an acoustic fit. So once we've adjusted the hearing aid to the appropriate prescription for the patient, then it's important to teach the patient how the device works. They're very simple. We put them on children so they can't be too complicated, and answer any of the questions they may have about putting the little battery in or taking it in and out or cleaning it and things like that. It's very important that the patient understand those things. But in addition to just talking to the patient about the hearing aid itself, we talk to the patient about strategies. It is so important to realize that even when you have a hearing aid on, you're not going to hear like a normal ear. So there are strategies: where you sit, the type of environment that you're in, looking at the talker's face, having people slow down a little bit, trying to use different programs in the hearing aid for different listening situations. The hearing aids are very unique now in that you can have different settings for different listening environments. And when you explain to the patient how these work, then they can make some manipulations on their own for unusual listening situations to help cope with those in a better way. And then the last thing that we try to explain to all of our patients is expectations. Hearing aids are never our natural ear again, because we're dealing with a damaged auditory system.
Right.
So simply making it louder is really not the answer. So when you understand that hearing aids will make a big difference, but they will not totally resolve the issue, then I think people do a lot better. I think it's a big mistake to have a patient feel like getting a hearing aid is going to give them the hearing that they had when they were 16 years old, because that's not the case. But at the same time, I think the average patient can expect a 70 to 80% improvement in their ability to understand once the hearing aids have been utilized. So once the fitting has been completed, then we go to the third stage, which we'll talk about in the next session. And that's what we call a trial period. That's where the patient will actually take the hearing aid and utilize it for about a month to make sure that it's comfortable and make sure that it's meeting their needs. And that gives the audiologist an opportunity to fine-tune it, since all of these devices are digital and very, very adjustable. So next time we'll talk about a trial period with hearing aids.
Sounds good. And if you'd like their expert advice at Audiology Hearing Aid Associates, their Lynchburg location is on Langhorne Road, 434-528-4245. Also on Main Street in Danville, 434-799-6288, and online at digitalhearing4u.com. We'll be right back.